Mental health is not the same as mental illness. Although they are increasingly used interchangeably, mental illness affects mental health, which also affects health generally. For the World Health Organization, mental health is a state of mental well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to the community. Mental illness, according to the Center for Disease Control, are conditions that affect a person's thinking, feelings, mood or behavior, including depression, anxiety or bipolar.
So a little bit of anxiety, they say, is good. But then when it gets to the point where I'm not able to control my anxiety and then it continues, then it gets to the point where I may be diagnosed with anxiety disorder. So the difference between mental health and mental illness is I may be in a state where, yes, I'm not clinically diagnosed with a condition, yet I'm unstable with myself. So how do we curtail it? Two things. Mental health issues are caused by environment and genetics. If it's genetical, then it's more of seeking treatment. If it's environmental, maybe financial stresses, education, anything at all, then what you probably want to do is identify what the stressor is. Two, know your baseline.
Fear, worry, and stress are normal responses to life's burdens. But for instance, when the world is faced with the uncertainty of COVID-19 pandemic, mental health is impacted.
I was an outgoing person, so to speak, but all that was stripped away, all thanks to the pandemic. At some point, I just felt like, look, what's the usefulness, what's the essence of living? After much thought and dilly-dally, I decided to seek the help of a professional. That was when I was diagnosed with clinical depression. It was when I was able to get across to a professional that I could give a name to what was wrong. I was able to share with family members, and then everyone tried their possible best to be there for me. Everyone can only do as much as they can. At the end of the day, you still have to develop some coping mechanisms for yourself. So music, exercise, taking a walk helped me to cope with this period of my life. Whenever I have the opportunity to speak with people who are going through similar experience, I try to share my story, but to let them understand that we're all human and it could happen to anybody. What I would love to see is where is a community, a place where we treat mental health the same way we treat every other form of health, and not make it seem like it's a taboo. Just knowing that you have people that you can talk to when the chips are down goes a long way. So I'm where I am today because I sought help.
Added to the fear of contracting the COVID-19 virus is the impact of significant changes to our daily lives brought on by efforts to contain and slow down the virus spread, such as social distancing, working from home, temporary unemployment, homeschooling of children, and loss of physical contact with loved ones and friends. Ghanaian journalist Nana Achia Adepa experienced depression after being out of job amidst COVID-19.
This is in relation to what I'm about to talk about as my inability to get a job or secure a job as a young journalist or a young girl who wants to make meaning out of my life. So these are some of the things I have come to know that many people go through per my experience. One is, let me say, mental health problem or mentally being drained by the fact that you are not so socially active, or you are not involved in an activity, or you don't have one responsibility that you are known for.
Research suggests depression is the most common women's mental health problem. New mothers, for instance, experience strong feelings of sadness, anxiety, and tiredness. that last longer after giving birth. Some mothers have shared their postpartum depression stories. Young people around the world aren't spared from mental health difficulties either. A 2019 study in the US by JAMA Psychiatry reviewed how social media has devastating effects on the mental health of users, especially young people. Budgetary spending on health in most low-income countries is not prioritized. Then talk of mental health spending. As we commemorate World Mental Health Day, the World Federation for Mental Health has called for effort to decrease the ever-increasing gap between the have-nots and haves on the theme Mental Health in an Unequal World.
There is some worrisome results. The Atlas is telling us that there is a global shortfall in investment in mental health. Only 2.1% of the global health budget around the world is spent on mental health. And unfortunately, this is unequally spent. 70% of this budget is actually spent on long-stay mental hospitals, which are centralized services, and most of the cases they are away from the community. Atlas is also telling us that the situation of mental health integration into primary health care is very limited in most countries.
So tell me, how are you? The United Nations encourages us to talk to people we can trust about how we feel as a way to help. Reporting for Metro News, Bright Nanakwesi Aminim.